Thank you, Jen, and good morning, everyone. It's good to see you again today on another sunny morning in British Columbia, southern British Columbia. I want to talk a little bit today about the challenges that people are facing with mental health. These are unprecedented times. People's lives have been turned upside down. If you're a frontline worker, you're working hard, you're stressed, your family is stressed, you're under intense pressure. People have lost their jobs, businesses have been shuttered. Seniors are safe at home, but they've lost their connection to the outside world in many cases. And those who do live alone or live in remote communities are feeling more isolated than ever before. And whether you're feeling stuck at home or separated from other people, this pandemic has been difficult for all of us. Everyone is experiencing stress, anxiety, depression, and disconnection from what the world was supposed to be. And so as we look at the many, many challenges, we've talked about programs for financial assistance. We've talked about programs to ensure that people are staying in place, to ensure that our borders are safe, to ensure we're doing everything we can to help people financially. We also need to step up and make sure that the COVID-19 pandemic is not going to adversely affect our mental wellness, whether it be through anxiety, depression, or other stresses in what are now becoming our daily lives. And of course, growing up, young people particularly are hard hit by this. We all remember being young, whether we were in high school or college or even in our early adulthood, connecting with other people is part and parcel of what we do. We are social beings. This has been extremely challenging. And so what I've asked Minister Judy Darcy to do is to look at the range of programs that are available to people today and how can we supplement those by making sure that we can go virtual on some of these initiatives so that we can't necessarily go and visit people face to face. We can't meet people in large groups, but we can certainly meet with people through technologies that have been proven very, very effective, not just for frontline workers, not just for continuing our interactions in the work world, but also with school, also with social connections. So I'm very pleased to announce today that we put another $5 million toward virtual mental health services. Judy will go into the details on those, but these are critically important times for all of us. And we need to hang together, and we need to recognize that although we may feel stress, we may feel bouts of depression at the challenges that we face as individuals, as a family, and as a community, together we can get through this. And the acknowledgement that mental health is something that we need to address has never been more present as it has been over the past number of years. When we appointed Judy Darcy, the first Minister of Mental Health in Canada, it was with a view to protect people who were feeling vulnerable. At this difficult time, Judy's work and the work of healthcare providers, particularly mental health workers, social workers, has never been so important. So with that, I'll ask Judy to go into the programs that we're going to be announcing today.
Now over to you, Minister Darcy.
Thank you so much, Premier. I'd like to begin by acknowledging that we're on the traditional territory of the Musqueam, Tsleil-Waututh, and Squamish nations, the Coast Salish peoples. Good morning, everyone. And let me begin by acknowledging, as the Premier did, the incredible stress and anxiety that I know that so many people across British Columbia are dealing with at these really unprecedented times. The isolation, the loneliness, the financial stress of losing a job or losing a business, homeschooling with your kids, the fear of becoming sick with COVID-19. These are taking a tremendous toll on all of us. And we're seeing increased anxiety, increased depression, grief, loss, loneliness, and overall stress for people from all walks of life in all corners of the province. And many of the traditional ways that we're so used to living, many of the things that bring us joy have been put on hold, whether that's celebrating birthdays or anniversaries with people we love, whether it's getting married, whether it's playing team sports or doing group exercise classes, going out to a restaurant or visiting with family and friends. And some of the most difficult things that any of us ever have to do in our lives have become heartbreakingly impossible, like not being able to comfort someone who's seriously ill and not being able to hold the hand of someone who's dying. And while we know that these physically distancing measures are temporary and are in everyone's interest, It's important to recognize both the immediate and the long-term impacts that this pandemic can have on people's mental health and well-being. Frontline service providers and community agencies are giving everything they possibly can. They're pouring their hearts and their souls into meeting the growing and the changing mental health needs in our communities, but they cannot keep pace with the increasing demands for help, and that's why we're here today. We know that staying connected while staying apart is more important now than ever before. So we're working with our Indigenous partners and with the Canadian Mental Health Association, BC, with Foundry Youth Centres and others to make sure that people can stay connected to mental health care while doing their part to slow the spread of COVID-19. And just like the physical distancing actions we're taking to flatten the curve in the coming weeks, the actions we take now to look after our mental health and the well-being of our communities will reap benefits down the road. So today, we're announcing the expansion of virtual mental health supports across British Columbia. We're expanding virtual community counselling programs so you can talk to a trained professional in your community from home in rural and urban British Columbia. We're launching a Foundry Youth virtual clinic so young people and their families can connect to integrated, clinically supervised mental health, substance use, and primary care services. We're increasing access to Bounce Back, which is a free evidence-based telephone and online skills building program for people with mild to moderate anxiety or depression. And now, very importantly, anyone can access Bounce Back without a referral from a doctor. This is huge, and this will help so many people in our province. We're increasing access to virtual care for First Nations, Métis, and urban Indigenous people, and we're bolstering online peer support programs and virtual care for immigrants and refugees. And very importantly, we're creating a new online hub and virtual peer support network for frontline community healthcare workers. We need to make sure that we take care of the healthcare heroes who are risking their lives to keep us safe. And we're partnering with organizations like the BC Psychological Association, who have stepped up to announce that, and these are the last figures as of yesterday, 200 psychologists across British Columbia have volunteered their services to support frontline healthcare workers. Now more than ever, we have to take care of ourselves and we have to take care of each other. And I cannot tell you how inspired I have been to see people stepping up all across the province in so many different ways to support each other. And I want to appeal to each and every British Columbian today, reach out to your friends and family. Check in on your neighbor or your elderly relative. Something as simple as a phone call or a text or a note can have a hugely positive impact. And whatever you're feeling right now, please remember that you're not alone. And please remember that physical distancing does not have to mean social isolation. Social connection is more important than ever before. And please know that professional resources are available if you need them now or down the road. We will get through this together.
Thank you, Minister Darcy. We are now going to take some questions. A reminder to reporters on the line, please press *1 and unmute your phones. You won't be audible until we call your name. We're going to start with a question from Binder Sajan.
Hi there. This is a little bit off topic, but relates to the stress that a lot of people are feeling right now. The federal government has admitted that some people have been missed with the benefit programs that it has put out. And I know that previously, Premier, you've said that the goal here in BC is to fill those gaps. Is the province looking at helping people who maybe don't qualify for EI and so don't qualify for the $1,000 benefit from BC, who don't qualify for CERB, and as a small business may not actually qualify for some of the loan relief programs? Is that one of the gaps that you're looking to address?
Yes. I'm supposed to wait 2 seconds. Sorry. Yes, thank you for the question. And these are just the sorts of things that we were waiting to find out. There's a comprehensive series of programs that have been put in place by the federal government. We have said clearly from the beginning, we put aside over $5 billion to fill gaps, and now we're seeing those gaps emerge. We have put our task in front of us to make sure that as people go through the federal process, don't find a place for themselves, that they can come to the province developments and seek redress of some kind. But for the vast majority of people who have qualified through the CERB programs, that opens up opportunities. For example, today, our rental supplement program will go live. People will have verification that they've been approved at the federal level. We can get them dollars starting today. Our BC Hydro programs have already been up and running so that people can get the holiday or the deferral that they're looking for on their hydro bills, so that we can see liquidity for small businesses and, of course, not having to see outlays of cash from people who've just lost their jobs. But the whole point of saying to the public, the whole point of working with the federal government was when the programs go live, as they did this week in Ottawa, that's when we see clearly what people can fit into and what they can't, and we'll build from there. And we won't be doing that alone. The federal government has been fairly clear as well that when they see gaps, they're going to take steps to help fill them. So I'm confident that we are now in a place, I guess 5 weeks for BC, 3 to 4.5 weeks for other jurisdictions. We're getting the hang of this. We're creating these programs on the run, and we're doing our level best to make sure that people are well during this difficult time. But the question you ask is a legitimate one, and we're working on that effective on Monday when the federal programs became live.
Thank you very much. Our next question is from Lisa Yuzda.
I'm wondering, Premier, a couple of things of where you see the biggest gaps right now of people who are losing money, and how you think that the steps that you've taken for landlords and tenants, because, you know, rent continues to be one of the biggest pressures on people, how you think those programs are working so far, because we're hearing from some landlords are seeing online messages where they're saying that they're just not going to rent empty spaces because they don't want to worry about having to deal with this right now.
Well, I'm concerned by that. That's not what we're hearing. Our Minister of Housing has been working overtime to make sure that we're trying to find homes for the hard to house. We're trying to do a whole bunch of work on issues like the downtown east side and other homeless and marginal populations across BC, not just in urban centres, but in rural and remote areas as well. And this is a unique opportunity for government to provide programs regularly and over decades, to take a look at those programs. How can we rethink how we interact with people who are not fitting into the programs that have been developed over many, many years? So the rent supplement program was a step forward. We'll be building on that and other initiatives to make sure that we're helping those people who desperately need it. But in order to get started, you have to get started. The program is in place. It's live today. And as time goes by, we'll see where the gaps are. We've heard, of course, from small businesses who are seeking rent relief from their landlords as well. And when you're looking at commercial undertakings, you have to make sure that you're doing this in an equitable way and balancing out where those dollars go. And it also helps when we've got financial institutions working with us, and that's starting to turn around as well. All hands are on deck here, private sector, public sector, trying to find ways to make sure that the vast majority of people who have been adversely affected, and they are over 1 million people who have lost their jobs in Canada, 130-some thousand here in British Columbia, we need to focus on them first and foremost, and that's exactly what we're doing.
Our next question is from Tanya Fletcher.
Hi, Premier. I'm wondering if you could just talk about, as we're heading into the long weekend, we know the message, stay home, but are there concerns that with the closure of BC parks, there could be pressure on the remaining recreation spots that have not formally closed? And on that, some search and rescue teams have also raised concerns about people, skirting the closures and still gathering in the backcountry to enjoy the nice weather, and municipalities, too, worried about crowding in local parks.
Yeah, those are legitimate concerns. We've been fairly clear, I think, abundantly clear. Minister Heyman, with respect to BC Parks, Minister Dix and Dr. Henry, about the importance of not traveling unless you absolutely have to. It's going to be a wonderful weekend in southern British Columbia. I can well imagine people are going to be going outdoors, as they should. We're talking about mental health today. Nothing is better for one's sense of well-being than to have the sun on your face and the calmness of being outdoors. But you don't have to be at a park to experience that. You can be in your own community. You can be in your own neighborhood. Those who live in apartment buildings have a bigger challenge, but getting out and onto the streets and self-distancing, making sure you're 2 meters apart, focusing on ensuring that you're not interfering with someone else's well-being is the best way forward. This is going to be a challenging time, but as we've been doing all week, appealing to people as this long weekend comes up, whether they're faith groups who look at this as a time of reflection and coming together of family and other people of faith, we need to pause that. We need to look at different ways for us to connect. The programs that Judy outlined just a few moments ago are the first steps in getting us to a place where we can focus on our well-being, our mental health, and I think that we can do that without going to a public space. We can do that without interfering with someone else's ability to be comfortable outdoors, and that's what I hope all British Columbians will do over the coming days.
Next, we have a question from Mary Griffin. Mary, go ahead. All right, we're going to move to Moira Whiten.
Hi, Premier. Hi, Minister. My question today is about how many people you expect this funding to be able to impact. Like, how many more will be able to access services as a result?
You, Minister, go ahead.
It's impossible to put a number on it because there are a number of different programs, as we've mentioned already. The Bounce Back program that Canadian Mental Health Association BC puts on has reached thousands of people across the province. Now it's going virtual, and they've beefed up their team of counsellors who are at the end of the phone. The BC Psychological Association that has stepped up to be there to support frontline healthcare workers. So there's quite a bit of capacity in there. It's impossible to gauge numbers. We just encourage people who are feeling stressed, anxiety, depression, to go to a new website, go to the Government of BC website for COVID-19, and there is a new link there for mental health, and you can find all of the services that are laid out there. Of course, people have different mental health care needs, just as they have different physical health needs. So there are programs that deal with mild to moderate anxiety and depression. There are programs for kids, there are programs for parents, and very importantly, there are programs for seniors, and very importantly, there are programs for frontline healthcare workers.
Next, we have a question from Rob Buffum.
Oh, good morning. Thanks for your time. I just had a question relating to, for people who are now out of work, so they don't have the income they did before, they don't have the benefits for counseling or therapy. I'm wondering if you can comment on or expand on what supports will be available for them. Obviously, there's the virtual programs, but will there be subsidized counseling or any steps like that being contemplated?
Over to you, Minister Darcy.
Thank you. We already rolled out in the fall $10 million in counseling in funding to community agencies, community counseling agencies across the province that provide either no-cost or low-cost counseling. And we've been working with them together with the Canadian Mental Health Association BC and Foundry BC, because all of those programs are free. We fully recognize that too much through our history, access to mental health care or addiction supports have depended on the size of your bank account. We're working to change that. And these programs, the overwhelming majority of the ones that I've referred to today are free or very, very low cost, so that access to mental health care in these unprecedented and difficult times does not depend on how much money you have in your bank account.
Our next question is from Richard Zisman.
Are you concerned, Premier, that these jobs that we've seen disappear in March will be jobs that are gone forever in British Columbia? And are you concerned about what we will see in terms of job losses for April, May, and potentially longer than that?
Thanks for the question. I'm certainly concerned at the massive uptick in unemployment across the country and here in British Columbia. As Minister James said earlier today, the strength of our economy prior to the pandemic's arrival on our shores puts us in a solid position to prepare for recovery. And what we've been doing from day one is focusing on how we will restart our economy when the all clear comes and we have a better sense of public health being covered off. We can then get back to the important work of restarting the economy. There has been, of course, many essential service workers who have continued to work, not just in public health care, but also ensuring our supply chains are open and people get the goods and services that they need on a daily basis. All of that activity has gone up. The number of retail outlets that have remained open to provide those services have seen enormous spikes in activity and product going out the door. And I'm confident that there is a pent-up desire within the community, certainly within the retail sector, to get back into the game, but we have to make sure we do that in an appropriate way. On the tech side, we had a briefing yesterday. I hope I'm not breaching cabinet confidences here, a company called Thrive Health, who emerged through this pandemic with an app that allows people to take a look at their symptoms and then determine where they should go, have been hiring people in the 10s and 20s for the past number of weeks, from a small startup to now what is a pretty going concern as Canada and other jurisdictions are picking up this application. So the tech sector, which has been struggling at the moment, will, I think, pick up immediately upon the high sign, and will be going full guns from there. The challenges in things like film and television, which is an enormous employer in British Columbia, completely ground to a halt, not just in British Columbia, but across North America. What I've been hearing from Minister Bear, Minister responsible for tourism, arts and culture, is that Hollywood is looking at what we've been doing in British Columbia very favorably. They've seen that the curve is starting to bend in the right direction. They see the programs that we're putting in place, and they see an opportunity to return to British Columbia perhaps faster than they will to other parts of North America. So that's a competitive advantage for us because of the work, not of government, but because the people of British Columbia have taken this on very seriously and focused on their personal well-being, the well-being of their family, and then their community, and then the whole province. And that's why I'm pretty excited about the work we've been able to do behind the scenes to get to a position to kickstart the economy when the time is right. Later today, I'll be meeting again with my Economic Recovery Task Force. I've been reaching out to businesses, to labor leaders, to not-for-profits that are not part of that process, getting feedback, as have all my ministers, as have members of the opposition. And we can put all of that stuff together, I think, fairly rapidly in British Columbia. And although it's dire today, I think we should be hopeful for the future that when the opportunity presents itself, British Columbians will step up and our economy will get back to a very healthy position as quickly as we can possibly do it.
Next question is from Lisa Cordasco.
Thank you. Good morning. How will you ensure access to virtual care for seniors who do not use the internet and do not use computers?
Well, let me start on that, and then Judy can fill in the details. Thank you for the question, Lisa. And one of the things that we all need to do, particularly if we have seniors in our sphere, is to reach out to them by telephone. I don't know a senior who doesn't have access to that technology, and make sure we're connecting with people, hearing their concerns, seeing if they need any help. Can we drop something off for you? And those connections need to be reinforced more so now than ever before. But those who don't have access to the virtual also have access, I'm sure, to other healthcare providers, which can put them in touch with mental health workers to address levels of anxiety or stress that seniors or those without technology can't access at the moment. But I'm sure Judy can fill that in a bit more detail, with more detail than I just did.
Over to you, Judy.
Yes, there was an announcement last week or the week before about services being provided for seniors at bc211.ca, and that's very much both for seniors themselves that are able to access it, but also for family members of seniors and of volunteers. And they can get information there about both how to support a senior with isolation, support them with the food or the groceries that they need, getting their prescriptions, a wide variety of things that volunteers are there there to help support seniors, because this is a very, very difficult time for them, and as we know, and we're not able to visit our seniors, our grandparents, our loved ones at times like this, and that's very much where relatives need to step up and volunteers need to step up by bringing things by, dropping them off, phoning them, staying in touch in every possible way.
Our next question.
I wonder if I can about the job stress issue, because I think with the news that has come down today from the federal government and also the figures for British Columbia, losing a job, losing a business can be the most life-changing and the most stressful thing that any of us will ever experience. And that's one of the reasons why we recognize that there need to be more mental health supports for people, whatever it is they're dealing with, whether it's low-level anxiety or depression or a major life-changing experience like losing a job or losing a business, being unemployed. Mental health supports are there for you, and I would really encourage everybody to go to the Government of BC website, COVID-19, and click on the mental health link, because there are supports there to help you get through this very, very difficult time.
Our next question is from Angela Jung.
Hi, Minister Darcy. What's your reaction to news of the positive case coming from the downtown East Side shelter? And what can be done about people on Hastings Street who are just too close to each other and can't practice physical distancing? They say they can't stay home because they need the money from vending to survive. So what's your response to this?
Yeah, before you start, Judy, let me just frame that a little bit. Thank you, Angela, for the question. And this is a significant challenge. Dr. Henry's identified it. We put together a cross-ministry team led by Minister Shane Simpson, who has represented East Vancouver for 15 years in the legislature, born and raised in East Vancouver, and is the minister responsible for social development. And he's pulling together a cross-government team, including Minister Robinson with housing, Minister Darcy with mental health and addictions, Minister Mark from advanced education, who is the representative for the downtown east side, as well as Minister James from finance and Minister Conroy from children and family development. And we're bringing all of these ministries together to look at not just the downtown east side, but also marginal populations across the province, to focus on how we can, in this healthcare crisis, focus on making sure we're delivering programs in a way that allows these marginal populations to do what we're asking all other British Columbians to do. We've increased an emergency grant to people on income assistance that will help them get through the next number of months, so that they're not focusing on trying to find a few extra dollars on the street and not engaging and interacting with a host of other people that might not be in their best interest in terms of their health, as well as their mental health or potential addiction challenges. That's the focus of government right now. This is a problem that's existed for decades, and it will not be resolved over a weekend. But we see this as, again, as many of these dark clouds also have silver linings. And we're hopeful that this cross-government approach, which has been tried in the past, but not with the urgency of a healthcare pandemic. This is the second healthcare emergency for marginal populations. Judy's already been working on the addiction side of that for the past 3.5 years. These two issues coming together provides us an opportunity to work more closely when we get the healthcare workers in place to deliver these programs and these services, to make sure that life is better for those individuals and better for the broader community as well.
Over to you, Minister Darcy.
Yes, well, just building on what the Premier said, I'm sure that you've all heard, the Minister of Housing and Minister Shane Simpson from Poverty Development have already announced 367 new spaces in hotels and community centres, so that people who are experiencing homelessness can self-isolate, extended 200 winter shelter beds to keep them open, in addition to the things that the Premier referred to, the $3 million emergency grant to Food Bank BC. In our ministry, we have been certainly seized with the reality that we're dealing with two public health emergencies in this province, and that people who are struggling with addiction are vulnerable in both ways, both of developing COVID-19 and at increased risk of overdose. and especially if people are precariously housed or homeless or living at close quarters, or if people are already on safe prescription medication and need to go to a pharmacy every day, which is something that we don't want people to be doing, going to pharmacies or grocery stores every day. And that's why we were very grateful that the federal government provided exemptions under the Federal Controlled Substances Act that allows greater flexibility in order to be able to cope with a situation, an unprecedented situation like we're dealing with today. So we made an announcement on the first day we possibly could 2 weeks ago about the Made in BC guidelines that will enable enable more prescribers to get safe prescription alternatives to the poison drug supply out to people, more flexibility for pharmacists so that they can provide longer prescriptions so people don't have to come into the pharmacy as often, delivery at home for your prescriptions by pharmacy staff. And we are working with the health authorities, we're working with all the community agencies, we're working with BC Housing, we're working with everybody connected with the overdose crisis to make sure that those new guidelines get out there, that everybody is aware of them, so that we, at the same time that we are flattening the curve in the COVID-19 crisis, and all of us are working to flatten the curve, we also need to put maximum efforts into stopping overdoses.
Our next question is from Brishti Basu.
Hi, Premier Minister. Thanks for taking my question. I was wondering if you could give me an idea of how many people, mental health workers and former long-term care and home support workers have been hired through this $5 million fund.
Please go ahead, Minister Darcy.
Thank you. I would have to get back to you with precise information because, as you can see, this initiative is very much about partnerships. There are a lot of different organizations involved in this to whom we're providing funding. I do know that the BC Psychologists Association, as I mentioned, and this is just a wonderful initiative, they've had 200 psychologists who have volunteered to provide their services for free to frontline healthcare workers. But I know that Foundry BC, which is the youth center network, that the CMHA-BC have both staffed up in order to meet these needs. There's a mobile response team, which the government has funded for a few years to support people on the front lines of the overdose crisis. They have increased staffing in order to also provide support for people on the front lines of this crisis. So, but we also believe that by many of these agencies being able to go virtual, they will both have expanded staff and expanded capacity as they do that. And we'll be looking at it very closely. We'll be the kinds of calls that are coming in, what kind of help people are looking for. We'll be tracking that, and we'll be coming back and revisiting this if we need to.
And our last question is from Colton Davies.
Hi, Premier. Wanted to ask about forestry. Obviously, that industry has had its acute challenges for more than a year now, made more challenging by this crisis. Just yesterday, we learned that a mill in the Kamloops area, Aspen Planers, has indefinitely shut down 3 mills in this area, those being in Merritt, in Savinaw, and in Lillooet. I'm just wondering, do you worry about the future of the forest industry and the future for communities in BC that rely on forest companies as their biggest employers and biggest taxpayers? Thank you.
Thank you, Colton, for the question. And I have been gravely concerned about the future of forestry in British Columbia since I was sworn in as Premier coming on almost 3 years ago. We arrived at the height of yet another dispute with our largest trading partner on softwood lumber. We had seen that over the past 2 years, the end of the beetlewood that was keeping many mills going and changing the way we paid rent on the land, keeping in mind that our public forests are a public asset, and we ask companies to harvest those assets and doing it in a way that creates wealth and prosperity in communities communities across the province. That dynamic has been changing over the past number of years, and to have successive fire seasons on top of the softwood lumber dispute, market prices tumbling as challenges around housing initiatives in the United States and elsewhere started to tumble as well. Layer a pandemic over across of that. Of course, I'm very, very concerned about the forest industry, but I am absolutely buoyed by the resilience of forest-dependent communities. Merritt, for example, where the Aspen Mill I visited several times over the past number of years. The people of Merritt are resilient. They will find a way forward. Our forest assets are still very vital to our economy, not just in rural BC, but in metro areas as well, and of course on Vancouver Island. So I'm confident that as we start getting back out from underneath the pandemic crisis we are in today, we can refocus our efforts on moving to a more value-based approach to forestry rather than volume. When we had pine beetle that we had to get out of the forest as quickly as possible while it was still marketable and to keep our live forests prosperous, we had to cut faster than we could sustain over the long term. Now we have to focus on adding value. Mass timber construction, cross-laminated timber facilities are starting to emerge in British Columbia. I think that's the future, and I'm confident that our rural communities will be there well into the future, depending on forestry and a host of other economic activity that keeps British Columbia so dynamic and diverse, from the Yukon border to Washington State and to the Pacific Ocean and the Rocky Mountains. We're very, very blessed to have an abundance of natural resources, and even more blessed to have resilient people that are innovative and dynamic. And when we get through this, we're going to be as strong as ever.
Thank you, everyone. That's it for today.
Thanks very much.